One of the other questions you have is that after being diagnosed with diabetes, you may have been also told you have peripheral arterial disease, abbreviated PAD. It's very common to hear it in commercials and see it in the media these days because it's very common. It comes in different stages. It starts off as a very mild condition where you have a small blockage inside the vessel wall of the vessels to your foot and leg. Blood flow is very important for allowing you to maintain function of your foot and allow you to heal the wound site as it occurs. Diabetes has been shown to cause these to occur at a higher rate. The reason this occurs is because there's damage to the vessel wall, which is then replaced by an area of scar tissue, and that scar tissue then allows fat in your bloodstream to collect in these areas, causing a blockage. The other problem that affects diabetics is called arterial sclerosis, which is hardening of the artery, more commonly referred to. This also occurs at a higher rate in diabetics. And what ends up happening in this situation is the vessel's not allowed to expand like it normally does. Typically when someone has an injury to their foot or a wound to the foot, the body says, okay, here's a problem we need to address, and so it dilates those blood vessels, opens them up, and allows more blood flow to reach that area so that more of the healing factors, growth factors, things like that can reach that area. If the vessel is hardened, it can't expand, therefore it can't actually send increased blood flow to that area to help you to heal. These types of things reduce the blood flow, and they occur very slowly to the point where often a person doesn't realize the damage has occurred until much too late. Typically, the process starts very early in life, and it also starts earlier for diabetics, and it takes many decades in most cases to develop to the point where it causes damage. A person can go for decades with very severe blood flow damage to the foot, but then one morning wake up, stub their toe on a dresser or the side of the bed, and their toe turns black and dies, and they don't understand how that occurred so quickly. And the reason is because they haven't had a good follow-up to know what their actual blood flow is to that foot, which could include some very simple tests in your doctor's office or some more advanced tests in a circulation center. Some of the risk factors associated with PAD or peripheral arterial disease include diabetes, high cholesterol, high blood pressure, and smoking. Any of these variables that can be changed should be changed. You should work with your doctor on a close basis to reduce any of these risks.